Okay, Bismillahirrahmanirrahim. Ala file speed, soft copy, page number 1. Okay, the first topic is the supportive management. What do you mean by the supportive management? For example, where the initial topic is the gastroenteritis, how the patient of the PEDS department presents, what is the time duration, which pathogen is involved according to the duration. For example, if somebody is presented with the nausea, vomiting, diarrhea after the 24 hours of the traveling, after 24 hours of eating from somewhere, then the pathogen would be different. If the time frame is between the 48 to 72 hours, the pathogen would be different, and so on. So we would discuss one by one. For example, we have discussed in the adults, it is the same one in the peds, that if patient presents with the gastroenteritis, diarrhea, or vomiting within 1 to 6 hours, even he give you the history of eating from somewhere, even he give you history of traveling from somewhere, if this is the time frame, the causative pathogen would be Staph aureus. If after 12 to 48 hours, it would be Salmonella or E. coli. And the commonest pathogen, if the examiner asks you in the exam, that commonest pathogen for the traveling diarrhea, that is E. coli. E. coli, without mentioning the time frame. Generally, the causative pathogen for the traveling diarrhea is E. coli. 48 to 72 are Shigella and the Campylobacter. How would we differentiate between the Shigella and the Campylobacter? In Shigella, there would be, yes, we have discussed in the adults, Shigella. Yes, what would be the presentation of the Shigella?
Diarrhea.
Diarrhea, but what kind of diarrhea?
Blood. Blood.
Yes,
With blood.
Shigella would cause the blood in the stool. And the second one is the Campylobacter. If it is of more than 7 days, if with the blood, amoebic dysentery, if without blood, that watery diarrhea, that would be under giardiasis. That would be under giardiasis. Okay. Supportive management. For example, supportive management, if somebody is having the mild diarrhea, you would manage it through the oral rehydration therapy, through the ORS, okay, good fluid intake, better hand hygiene. And still, if the patient is having from mild to more antidiarrheal agents could be tried. If patient is having fever, then you could try the antipyretics. If patient is having the blood in the stool, the management totally would be different according to the causative pathogen, anti-amoebic or antiparasitic. Okay. If somebody is having antibiotic-induced diarrhea, the cause is the Clostridium difficile. The management would be vancomycin. The first question is, a child patient after eating a steak from somewhere, he got fever and abdominal pain. What is the management? Okay. Food poisoning. After eating steak, patient is having fever and abdominal pain. So this is the case of what? Food poisoning. How would we manage it? Yes. Symptomatic management, or would you go with the antibiotic?
Ma'am,
Supportive,
symptomatic
yes,
treatment will
supportive
be.
management. You would give the antipyretic, you would give the antispasmodic drug. Okay. 3-year-old patient presented with a watery diarrhea. First word, highlighted word with the watery diarrhea, along with the abdominal cramps. Dehydration there. After being exposed to the colleague with the same presentation at a daycare. So what would be the management? Again, the supportive one. You would give the oral rehydration therapy. You would give the antidiarrheal agent. You would give the antispasmodic. 4-year-old child presents with the several episodes of passage of the frequent non-bloody watery diarrhea, vomiting. How would you manage? Supportive. Child with a history of eating in a restaurant presented with the abdominal pain, nausea, vomiting. 10 days later, There is a blood in the stool, bloody diarrhea. Urine analysis showed 10 RBCs. What is the treatment? What is this condition? This is hemolytic uremic syndrome. Why patient is having diarrhea with the blood? Patient is having hematuria. Patient is having hematuria. What would be the treatment? HUS. Hemolytic uremic syndrome. What is the treatment? Again, supportive treatment. You cannot give the definitive treatment in HUS. You would give the IV fluid. You would give the, yes. What else would you give in the HUS? Hemolytic uremic syndrome. Adults में कर चुके हैं, शाबाश.
मैम स्टेरॉइड्स देंगे मैम फॉर हेमाटोरिया.
Steroid देंगे, अच्छा. Okay, what else? IV fluid. Why we are giving? Patient is doing the multiple organ failure. After giving the IV fluid, can we go with the plasma exchange as we have done in the adults? Patient could be a candidate of plasma exchange. Is there any role of antibiotic in the HUS?
Yes ma'am, plasma exchange.
Because the typical
Will,
treatment
give
that
plasma
named
exchange.
for HUS is the supportive treatment. What supportive treatment? Correction of the intake output record. Patient, if losing blood and patient is anemic, you could go with the blood transfusion. Still not responding, you could go with the plasma exchange. And even HUS patient could be a candidate of dialysis. Dialysis. Okay. Why I have said antibiotic? Because there is no specific role of antibiotic in the HUS. Sometimes you have to avoid certain type of antibiotics. A child developed a petechial rash in the legs. He has history of upper respiratory tract infection. Lab showing normal CBC, except the platelet counts were low. So ITP is there. What is the next step in the management? Petechial rash, that is, and he has a history of upper respiratory tract infection. Diagnosis is what? ITP. ITP ऐसे diagnose करते थे ना? When there is a triggering factor, upper respiratory tract infection, post that infection, patient presents with the thrombocytopenia. The diagnosis would be ITP. What would be the management of the ITP? Supportive. ITP treatment is the supportive. When you would consider the platelet infusion, हम discuss कर चुके हैं, the same criteria fit in the peds as well. For example, if the platelets count drop less than 30,000, would you consider the platelet transfusion, or it would be less than 15,000? Yes. When you would consider the platelet transfusion? यार सारा भूल गए, अभी एडल्ट्स वाला पढ़ाया था. Platelet transfusion indication. One is patient's platelet count less than 30,000. Patient would be having bleeding. Yes. And the supportive treatment means? What do you mean by the supportive treatment? What do you mean by a supportive treatment of ITP?
अगर platelets 30,000 से it is less than 30,000, we have to give steroids plus blood transfusion.
Yes, the first treatment that we
Then
used to give in the
platelet
ITP is
transfusion.
the steroid. Very good. First treatment that we give to the ITP patient is the steroid. Very good. Next is?
And then if the platelet count is too low and the patient is unstable, then we have to go for plasma exchange also, ma'am.
Platelet transfusion. And the definitive and the effective treatment of the ITP is splenectomy. Splenectomy.
Splenectomy.
Okay? Yes. Again, the same question. Patient is a candidate, diagnosed case of ITP. How would you treat that? Supportive treatment. It would totally depend what is the number of the platelets count. If more than 30,000, go with the supportive steroids. Okay, if less than 30,000, you could give the steroid immunoglobulin, and even patient is at the risk of the bleeding, you could go with the platelet transfusion. So it would total depend on the number of the platelets count. Otherwise, general treatment of the ITP is the steroid. When it is less than 30,000, you could even think about giving immunoglobulin. Sorry. Yes. A child with the watery diarrhea, history of the sick contact. Okay, this was the same question from the school, from the daycare. If the multiple children are having the same symptoms like watery diarrhea, management would be the supportive. 5-year-old boy has the right upper quadrant pain, normal bowel sounds, lab showing severe drop in the hemoglobin. First is the right upper quadrant pain. Number two, severe drop in the hemoglobin. Increased retic count. What does it indicating? Increased retic count is an indicator of hemolysis. Yes, increased retic count is an indicator of hemolysis. The next thing, blood smear show the target cell and the inclusion body. Your diagnosis is crystal clear now. Patient is having hemolytic anemia, and on the blood smear there are the target cells. What is your diagnosis? Target cells किसमें आते हैं? Inclusion bodies. Sickle cell disease. Sickle cell disease. Patient is having the right upper quadrant pain. Patient is in the hemolytic crisis. How would you manage? You would manage the patient through the rehydration and the analgesics. A child with a long history of the watery diarrhea, abdominal bloating, pain. What is the diagnosis? Long history means more than 7 days. Watery diarrhea, so it would be under the category of GRDSS. If the blood, then amoebic dysentery. Repeated bouts of diarrhea that can last up to 2 years. GRDSS. Treatment of the dengue fever. Again, supportive treatment in the dengue fever. Bed rest, antipyretics, fluid intake, good fluid intake, and you would avoid the NSAIDs. Dengue mosquito time for the activity, early morning. 2 to 3-year-old presents with a watery diarrhea, abdominal cramps, dehydration after being exposed to colleague with the same presentation. So gastroenteritis, probably viral, you would go again with the supportive treatment. Child with the watery diarrhea, bloodless management, supportive. Rotavirus. Rotavirus, if some patient is having, kid is having rotavirus, how would you manage? Depending according to the degree of the dehydration. Because rotavirus causes profuse watery diarrhea. If patient is mildly dehydrated, nothing to do, just encourage. If infant, you would encourage for the more feed and the reassure parents. If moderate to moderate, mild to moderate, then oral rehydration. If severe, then infusion, intravenous rehydration would be indicated. Neonate with the vaginal mucoid, neonate and now with the vaginal mucoid discharge, concerned mother, what to tell her? That is quite common. Why we are reassuring? What is this discharge? Yes, neonatal vaginal discharge. Normal है? Due to the hormonal changes, and why these changes happen immediately after the delivery, the hormone fall, and the baby or the neonate can present with a discharge from the vagina, female, obviously, okay, and it would resolve on its own by the 10 days after delivery. So nothing to do, just reassure the parents. Feverish child, 38 degrees centigrade, coughing, bilateral lung infiltrate, nothing else mentioned. How would you manage? Patient is having fever along with the bilateral lung infiltrate. What is this?
Bilateral lung infiltrate pneumonia. No?
Pneumonia. Okay, very good. And how would you treat that? Would you discharge on oral antibiotic? Would you admit
Antibiotics,
patient?
we have to go for cup score, ma'am.
Yes, very good. Card score 65, very good. And that is for the adults. 65,
Ma'am,
okay.
cup score, CURB, cup score, ma'am,
Oh,
not chat score, no.
okay, okay. CURB. But
Chat
even
score for
that,
stroke, na, ma'am.
yes, card score for the pneumonia. I understand your word. For the pneumonia. Hmm?
If
Oh,
more than 3, we need to
more
get
than,
hospitalized.
more than,
If it is 3,
more than 3, you would consider as an ICU patient. Huh?
yes, ma'am. And 1, we can
4A?
treat as a OP, and 2, we can admit the patient and
From
get
0 to
treated.
1,
And
Pata,
more than
from
3, we
0 to
should put
1,
the patient in the
yes.
ICU.
From 0 to 1, you can entertain that patient on the OPD basis. Okay? If the score is 2, then ward. If the score is 3, ICU. You're absolutely right. Okay? So in this case, they haven't mentioned about the confusion. They haven't mentioned about the how we score. One score for the confusion. One score for the increased urea creatinine. One score for the increased respiratory rate. Yes. इसी तरह है ना? And age is if more than 65 years of the age, then one score. So out of these 5, you would calculate the curve score. 8 months old with the asymmetrical breast enlargement. Okay. Infant with the asymmetrical breast enlargement and no other symptom. What is the cause? Again, this is physiological. You would just reassure. A child with the birth weight 3.5 kg, now weighing 3.1 kg, breastfed about 3 times every 5 minutes. What would you advise to mother? Nothing. That is again physiological. Baby do lose weight during the first month or the first 4 weeks of the life. So you would reassure. If baby is not feeding, then it is an alarm. Then we would go with a kind of intervention. 2 weeks old child suddenly had erythematous rash on his body. 2 weeks age, suddenly erythematous rash on the body. The child was afebrile and was stable. What would you do? Again, reassure of the mother because what is this called? Erythema. क्या कहते हैं इसको? Erythema toxicum neonatorum. That is again very common, physiological. So you don't need to prescribe any kind of medication. Mucous vaginal discharge in the newborn, physiological, nothing to do. You would counsel the mother, it would disappear by the 10th day. Child presented to pre-diagnosis clinic with a ejection systolic murmur. Yes, pre-diagnosis clinic with the systolic ejection murmur with no other sign and the symptom. This is called innocent murmur. Innocent murmur, common in the infant due to the increased blood flow. So you would reassure and discharge. Child with the 15 months can only babble. His mother is afraid because he cannot say 2 to 3 words. Sentence. Hearing test done and he was 5 months old and was normal. What is the best thing would you do? What would you do? Babbling is here.
Ma'am, 2 to 3 words, so they will 18 months may they will
18, yes,
they can
18
able to
to
do, no
40
ma'am. So
months.
we can reevaluate
Do nothing. You have to wait for the
18
2 years
months.
of
Yes,
the age of the
yes, ma'am.
baby. So you would do nothing and just reassure the parents. Very good. Child presents with the fever, vomiting, diarrhea on examination. Chest, there is a reduced air entry to the right side and the murmur was heard. The child CVS and the chest examination were previously normal. What is the management of the murmur? What would you do? Patient is
Innocent
having murmur
murmur.
during the fever. So there would be vasodilatation, there would be increased blood flow. So there would be murmur. It is called innocent murmur. What would you do? Once you would stabilize the patient, after the patient become afebrile, then you would re-examine. So answer would be B. Re-examine after this symptom subsides. 3-year-old going for the dental operation had murmur. When he stand, he disappeared. Again, innocent murmur, nothing to do, reassurance is required. Asymptomatic child scheduled for the dental procedure. Same question. There is a murmur regarding the position. Innocent murmur, reassurance is required. Child 3 years old fell from the bed. Immediately, child cried afterward, vomited twice, and there is headache. Physical examination and the neurological examination are now normal. So you would keep the patient under observation. Under observation for how much? कितना time के लिए रखेंगे?
Ma'am, 24 hours.
Yes, we have to wait for 24 hours and you have to look for the vomiting. If the baby is continuously vomiting for more than, the number is for more than 3 times, then you would consider the neurological consultation. If patient hasn't vomited, okay, then again just observation would be required and then you would reassure the parents. If the patient has vomited 3 or more times, you would definitely go for the neurological consultation and the CT would be required. Child was brought to the hospital with the airway swelling, skin lesion all over the body. The mother stated that he was in the party with his friend. What does it called? It is called allergic, anaphylactic reaction, allergic reaction. If there is a language delay, when the parents bring their child with the delayed language, delayed speech, first thing you have to go first with the hearing test. If hearing is normal, then you would think about the other things, autism and the ADHD. What to be screened in the neonates? Yeah, this is now mandatory in all the setups. Once the baby is born, we have to rule out the metabolic disease. We do take the sample for the blood sugar and for the thyroid, TSH level. Clear case of congenital prolonged QT syndrome, Jervell and the large Nielsen. Syndrome is associated, prolonged QT syndrome is associated with a sensory neural hearing loss. How? क्या रिलेशन है prolonged QT syndrome and hearing loss का? Yes. डेफनेस और prolonged QT syndrome का क्या एसोसिएशन है? नाम भी बता दिया उन्होंने, जर्वर लार्ज नील्सन सिंड्रोम का ऑटोसोमल रिसेसिव डिसऑर्डर होता है और इस ऑटोसोमल रिसेसिव डिसऑर्डर में देयर इज अ बायलैटरल सेंसरी न्यूरल हेयरिंग लॉस. बायलैटरल सेंसरी न्यूरल हेयरिंग लॉस, ये दो ही इसके टिपिकल फीचर है, बायलैटरल सेंसरी न्यूरल हेयरिंग लॉस एंड द सेकंड वन इज prolonged QT, prolonged QT interval on the ECG. ठीक है? Patient, this babies, these kids would easily go into the sudden cardiac arrest, sudden cardiac death. Okay? हमें पता है inherited prolonged QT syndrome itself could be an inherited disease. Torsades de pointis हम पढ़ते थे, inherited long QT syndrome होता है. कोई रीजन बता सकता है क्यों होता है? Yes. सब खामोश है. हाँ जी. चैनल्स का, लीकी चैनल्स का कोई चक्कर होता है इसमें कंजेनिटल prolonged QT सिंड्रोम में? कार्डियक सेल्स के कुछ चैनल्स होते थे जिसमें से सोडियम इनफ्लक्स, पोटेशियम इनफ्लक्स होता है और वहां पे कंटिन्यूअस इंपल्स जनरेट होती है. हाँ जी. कुछ याद आया कि नहीं याद आया? ठीक है, चैनल्स की प्रॉब्लम होती है कंजेनिटली, इनहेरिट करता है बेबी। और जब भी आपके सामने सिनेरियो आएगा रिगार्डिंग द जर्बल लार्ज नील्सन सिंड्रोम, this is again a prolonged QT syndrome that would always be associated with the bilateral sensory neural hearing loss. 2 years old child can't talk, probably does not understand, he have decreased hearing. What first decrease speech, decrease hearing, go with the hearing test, hearing loss examination. Baby abdominal distended, what is the first investigation? Whenever the baby comes with a distended abdomen, ultrasonography. Newborn, what to examine? Screening requires the metabolic disorder and the hearing. A child has connectorous sign, what do you have? Expect that patient, you tell his parents. Yes, connectorous. Deposition of the bilirubin within the basal ganglia. Baby would be mentally retarded. There would be hearing loss in the connectorous. Patient wouldn't hear his name or her name. There would be delayed speech, etc. 15 months old parents concerned about his development that only babbles, can't say to. Again, you would reassure the mother until age of 2 years or the 24 months. Then re-evaluate. 3-year-old boy come with his mother. She's concerned that he might have abdominal development. He goes to the daycare, understand only 2 words, command. Strangers can understand. There are many of the things they have mixed. Strangers can understand only 75% of his talk. Your action. At the age of the 3 years, he has an understanding of the stranger about the 75%. He could understand 2-word sentences. So what do you think? Is it normal? 3 years, 36 months.
Ma'am, 3 years and 2 words. 2 words is normal only, ma'am.
Yes. So that's why you would do nothing, just reassure the parents and re-examine after 1 year. At the age of 4 years. Newborn examination. Newborn examination, hearing assessment, vision, and metabolic disorder screening. In the newborn, immediately we used to look for the red eye reflex. That is physiological. If absent, refer to the pediatric ophthalmologist. Aspiration, meconium treatment. Meconium aspiration. It would lead to the respiratory distress. So you would go with the surfactant lavage. Surfactant lavage. If patient is not responding to the surfactant lavage, still the bronchi are constricted, patient is in the distress, then you would go with the nitric oxide. Nitric oxide. Mom comes to your clinic with her neonate who is 1 week of the age. She's worried because of her neonate lost 1.5 kg from his birth weight. Yes. What is the age of the baby? 1 week. And he has lost 1 and 1.5. So during the first month or first 4 weeks, that is physiological. Do not anything, just reassure the parents. Infant with the erythematous macules and the erythematous base in the base and the back and the trunk. This is the image which is attached. This is again erythema toxicum neonatorum. Physiological, nothing to do. Case of watery diarrhea. Case of watery diarrhea. What electrolyte abnormalities will you find? In the watery diarrhea, baby would lose the water along with the electrolytes. Which electrolytes? Sodium and the potassium. Sodium would be lost more as compared to potassium. So in watery diarrhea, baby would having hyponatremic or metabolic acidosis. When the baby is having profuse vomiting, baby would be having hypokalemia, hypokalemic metabolic alkalosis. Yes.
मैम जो प्रीवियस क्वेश्चन में एरिथेमा टॉक्सिकम neonatum उसमें just we have to do the reassurance ma'am because it leads to because it can be leads to severity also no ma'am.
No
So we have
severity.
to put the
It would subside on its own. Even the supportive treatment is not required for this. Nothing to do. Just reassure the parents and nothing to do. We actually counsel the mothers, do not wrap up the baby with many of the clothes. Okay, so you wouldn't prescribe any kind of medicine. Just reassure us, it would subside on its own. Sometimes the whole baby is like red, so even in that case you wouldn't do anything.
Okay, ma'am.
Primary mother worried about her 6 weeks old baby. He's tapping 6 week baby. He is stepping reflex is there. All the formula since birth. What? Acha, this is spitting actually. 6 week is the age. Baby is spitting all the formula milk since the birth. What most likely? This is again physiological reassurance is required. You would counsel the mother after every feed, give the birth. And there was another question near to the previous asking about the next step. Nothing to do. Burping is required physiological. Nine-year-old boy with the growth pain management. Growing pains, again important. You would do nothing, just the reassurance, healthy lifestyle, good diet, nothing to do. Do not give anything except if a baby is having, boy or girl is having severe pain in the leg, you could prescribe Brufen, etc. These kind of syrups to those child. Infantile colic. Infantile colic. Okay. My question to you that when it would start and when would it disappear? Infantile colic, yes, begins as early as by the 6 weeks.
Ma'am, it start
Yes. And disappear by the age of 6 months. Only
age of three.
yes, Fatma?
Ma'am, 6 months or 3 months, ma'am.
6
3 to
months.
4 months may
No,
disappear.
it would go by the 6 months.
Okay.
Then you could easily link it with the weaning food. 6 months is the age of the weaning. So by that time, it would go. A patient with the infantile colic scenario, mother mentioned normal feeding. Didn't say if it was a breastfeeding or the formula treatment. The options were similar to something like this. What would you do? Infantile colic. Age is the question. If the baby's age is less than 6 months, you would reassure and tell that give birth, and by the age of 6 months, it would go away. Infantile colic occurs during the first week of the life, it would appear, and by the sixth, it would disappear. Presentation of infantile colic, 6 weeks. Case described of infantile colic, what is the usual duration? Yes, first 6 months. After 6 months, it would disappear. Same question. Okay. Consult mother regarding infantile colic. You would counsel the mother that it would resolve at 6 months. A child with the excessive crying, and many of the mother have experienced there is an unexplainable crying, excessive crying, baby can't stop crying. You do anything, but baby wouldn't stop. There are the cases of severe infantile colic. There is a question, a child with excessive crying, can't stop crying. There is a history of the bottle feeding. On examination, child is restless, abdomen is distended, bloated. No other significant finding on examination. Cases of infantile colic. 2-month-old baby brought by the mother complaining about that he cried excessively since 2 weeks, and mother mentioned that he introduced a one bottle feeding at night. What is this case? Again, infantile colic. Same question, infantile colic. What is true about the infantile colic? Baby would present with excessive crying, abdominal bloating, and excessive passage of flatus. Typical symptoms of infantile colic, all other are normal. What is the appropriate? behavioral adaptation of the mother. So you would guide that by 6 months of the age, it would disappear. 6 week baby, the spit out. Whatever he drinks, he is now on the cow milk. His weight is in the birth is the 2.7 kg, and now he is 5.3 kg. So he's gaining weight, he's going great. You would do nothing, just reassurance is required. And if he spits, burp is required. That's it. Baby 4 months, distended abdomen, yellow color stool, and it becomes the color more darker, and after birth he passed stool. What is the cause? Yellow color stool. They said it would be a case of intolerance, milk intolerance. Baby is allergic to formula. How? How you know that this is formula milk intolerance?
मैम constipation हो रहे हैं
Okay, constipation है और
because the baby was on breastfeeding, ma'am. Now it is taking bottle feeding,
ये
and
दो
suddenly he
चीजें
is
हैं
developing
जिसका ये लिखिए ना,
constipation.
formula
So now
intolerance
he is
and
not
allergy.
adjusted.
Yes, allergy to formula means baby is more sensitive to that formula milk. Maybe some ingredients to which the baby is sensitive. Presentation would be same like that of biliary colic. Like baby would be having irritation, baby would be having problem with the digestive system. Yes, they have given you two other option, volvulus and diverticulum. Diverticulum which presents with the blood,